Martin Samuels. I'm the chair of the Department of Neurology at the Brigham and Women's Hospital, and I am the Miriam Sidney Joseph Professor of Neurology at Harvard Medical School. I am primarily a neurologist. I'm also an internist, and I'm interested in the interface between those two fields. And I graduated from medical school in 1971, so that's 42 years of practice. Well, I think Best Doctors is an organization which is trying to do something which is very admirable, which is to try to improve care for patients, to help patients to put their records together, complex records, and to get additional opinions to improve their care. So if I can help them to do that, I think that's a very admirable job. Well, there's a number of them. One is the depersonalization of medicine, sort of the degeneration of medicine into a lot of data and numbers, and getting away from the doctor-patient relationship, which has always been the most sacred aspect of medicine. And although it's important, obviously, to take into account modern data, imaging, genetic tests, if it costs us the doctor-patient relationship, the trust that exists between doctors and patients, that's going to be a very, very serious loss. So I think the challenge for us is to incorporate all the new information without losing the essential feature of the doctor-patient relationship. You might initially think that the treating physician might be threatened by Best Doctors because Best Doctors is basically offering people an additional opinion. But the truth is, good doctors value additional opinions. And one thing that's important for patients to learn is that if their doctor is threatened by an additional opinion, that's a bad sign. You've probably got the wrong doctor. Good doctors are happy to have additional opinions because none of us are perfect. We can always use some new ideas. And so most doctors will respond to a consultation by somebody from Best Doctors or a consultation from anybody else who's a legitimate physician in a very positive way, and will often be very thankful for it. Well, the model, the way it works now, is that this Best Doctors is really a benefit for members of different groups, such as large companies, which might offer this to all of their employees. So if I'm an employee of this company, I can utilize this as a benefit. It doesn't cost me anything additional. I simply request it, and then Best Doctors takes it from there. They collect all my records, they collate them, they get somebody to summarize it, they send it to an appropriate expert, they review the report of that expert, and then that report goes back to me and to my primary care doctor. So I don't have to do anything, basically, except raise my hand and say, "Can you help me?" The real quality of medical care relates to the quality of the people giving it. Everything depends on the people. And the thing about Best Doctors is that it's interested in people. It's tried to create, and I think has successfully created, a substantial list of people in almost every major medical specialty who really are good people, are highly respected by their colleagues. So it allows a patient to have access to the kind of quality that they otherwise might not have any way of recognizing.